Good afternoon, everyone, and thank you so much for joining us today for what is probably the cutest conversation of my entire science communication career. My name is Talia. I'm the Virtual Experiences Coordinator at the Denver Museum of Nature and Science, and in honor of our soon-to-close exhibition, Dogs, A Science Tale, we today are talking with several handlers as well as their medical dogs, their facility dogs from Children's Hospital, all about what their jobs are like, what these dog tours get to do on the job. And we are so excited to get to take your questions and hear your comments. So today we are going to get to hear from each and every one of these handlers and these amazing, adorable animals. And you, of course, can leave us comments, leave us questions. I will be watching along on my handy dandy device, and I'll be able to pull those questions and comments to share with our experts live and on the air. I do want to say a big hello to our Facebook audience. Hey, this is where we are going to be watching for comments today. If you are watching us on YouTube, we unfortunately do not have eyes on that channel, but hey, you're watching along and you get to look at cute dogs. So what could possibly be better? Again, we are so excited that you're here. We're going to get to hear from every single one of these handlers and these amazing animals, starting off today with Sarah and Galaxy. And Corey too might get to chime in. Corey gets to work with Galaxy too. So I'm going to go ahead and spotlight Sarah. She's going to unmute her mic and we're going to hear from her in just a moment. And I'm going to start you off with a specific question, Sarah. You probably heard me say a moment ago, everybody probably heard me say that these are medical dogs. These are facility dogs. You might notice that I didn't use the word service dog or therapy dog, which I think are pretty common terms in everyone's vocabulary when they think about dogs with jobs. So before you tell us a little bit more about Galaxy, who's just sitting in your lap like the sweet and perfect little angel that she is, can you tell us a little bit more about what that terminology means?
Yes. Hi, I'm Sarah, and this is Galaxy. He's one of our medical dogs here at Children's, and they are all three dogs that came from an organization that helps work with dogs to get them ready to work in children's hospitals or in hospitals with patients. So unlike a service dog that works with someone who has a disability or a therapy dog or an emotional support dog, these dogs are well trained to work in a variety of settings with a variety of patients. So they get to meet lots of people throughout the day. They work hard with them on their temperament to make sure that they are calm. And then we got paired with them and trained alongside them to be able to do the work that we do with them at the hospital.
That is fascinating stuff. Thanks for clearing up that difference. It's an important difference to note. Tell us a little about Galaxy, because oh my gosh, look at that face.
So Galaxy is a 3-year-old golden retriever, and he grew up in Georgia. All three of our dogs did, and I am his primary handler here at Children's. So all of our handlers are certified child life specialists. So we get to work with kids and teens and help them cope and help teach coping skills or prepare them for things that are happening in the hospital. And our three dogs help us do that. So Galaxy and I work in cardiology. So he's snoring on my lap right now, but we work in the cardiac intensive care unit and our cardiac step down unit. And so all of our patients have some form of heart disease. And so my work with Galaxy, often when we're in the ICU, it looks very different because Galaxy knows to be very calm and very quiet and gentle. He can hop up in bed with patients after they've had surgery if they're struggling with pain or they're just fearful of what's around them in the hospital, and we can teach them more about what they see and what they hear. And one of the biggest things we do is when our patients have heart surgery, it can feel really hard to walk for the first time after surgery. And so they can have different tubes and lines and things that can feel a little bit scary. And so Galaxy and I work with our therapies team to motivate kids and teach them and help encourage them as they walk for the first time after surgery in the ICU, in our cardiac ICU. So we like to bring a little bit of joy and silliness into the work that we also do. So Galaxy has multiple outfits that he gets to wear. So when he does walks with patients, he gets to wear these like 80s looking sweatbands. All three dogs have them. And we just try and bring a little element of fun into the work that we do. And we try and bring a little bit of normal into work that with kids can feel hard for them to be where they are. And Galaxy, one of the biggest things he loves to do is snuggle and sleep. And so he loves nothing more than to just sit right next to kids when they're doing hard things, and they'll just put their hand on his head, or they'll hold his paw and just help him feel really calm about what's happening. So that's one of his favorite things to do in the hospital. And Corey is actually his secondary handler, so she also gets to work with him here at the hospital, but in a different setting. So I'll let her talk a little bit about that.
Hi there. My name is Corey. As Sarah said, I'm Galaxy's secondary handler, which essentially means that he still gets to work with me here at the hospital and spend some time with me at home, but in kind of more of a part-term setting. So Galaxy works with me in our pulmonary and respiratory rehab unit. So any patient who would come to the hospital for anything to do with their breathing or their airways, they're typically seen on our floor. So that can be kids who are hospitalized for like an asthma exacerbation, cystic fibrosis, pneumonia. We also work with our trach and vent patient population. So he has the opportunity to work with patients during just a quick stay at the hospital for just a day or two, or with patients who are here for sometimes up to a year or more while their families are learning how to take care of them and their specific medical needs. So as Sarah was saying, it's really neat that we are able to incorporate these dogs and their skill set into what we already are doing as child life specialists. All of us that you see on the screen here were child life specialists before we started working with our dogs. So we are able to use our knowledge of child development and the impact that we know that a hospitalization can have on a child's coping and on their just typical development, and use that to incorporate our dogs so that we're making sure that we're helping kids to meet their therapeutic goals or milestones while using our dogs as well. One of the things that I love most about working with Galaxy is that he's able to help me really prepare patients for something that might feel big or hard or scary by sometimes trying things first. So Galaxy actually has his very own designated trach that we use when patients are at a point in their care that they are ready to move on from this thing that helps them to breathe. Galaxy will wear his on his collar so that we can show kids what it's like when that comes off, and we can show them that, look at Galaxy, he's still able to take those big deep breaths and still just fine without that. So getting to use like typical medical equipment that a kid is very familiar with and using the dogs to kind of reinforce those things or to help them understand this is what's going to happen with you and your body is a really special way to include our pups.
Yeah, I think one thing that's really important to note here is that it's so important for patients when they're going through something scary, like a big surgery, to feel comfortable and to feel like it's all going to be okay. That has huge impacts on how well they do and how well they heal. And even as an adult, going through medical procedures is kind of scary. It can be really, really frightening to not know what's going to happen. And just the idea of having a big and cuddly and lovely dog come and sit in my lap, come join me in bed and say, it's all going to be okay. That sounds amazing. And I didn't know that either about you might sometimes model procedures or medical equipment on the dogs. And honestly, I would be less freaked out too if I got to see a dog go through it first.
Yeah, we know that some kids prefer having more information. The more that they know, the better that they feel prepared for whatever is coming up next. So being able to include our dogs to kind of take away some of those uncertainties or those unknowns really makes a big impact.
Hugely. All right, we have a couple of other dog tours that we need to talk to this afternoon. And it sounds like next we are going to get to hear from Devon and Halo. And Halo is also currently passed out on the floor, looking really, really happy. And so we're going to get to hear from Halo and Devon about their jobs together. Let's go to you.
Hi, guys. Halo says hi, even though she's snoozing. So Halo and I have the privilege of working specifically with our rehab and trauma populations here at Children's. So our interactions are usually that emotional support right when a patient comes in following a trauma. Sometimes that is things like Sarah was talking about, where we provide a comforting presence or might be there to support during a procedure. But then we also help with things like ambulating for the first time after surgery or preparing a patient for their upcoming procedure, what they need to know, what might look different, answer questions they have. And Halo is a really comforting presence and always anything but judgmental. So kids and families tend to open up really quickly with Halo and I there, and we can provide support to them in a lot of different ways, both emotionally, but also by doing things like modeling it first. When it comes to getting an IV, or when it comes to wearing a special breathing tube called a nasal cannula. Halo doesn't have those things, but we can certainly show them on a stuffed animal or provide some support for a kiddo during those changes or those procedures. And then we also do a lot of co-treating with our physical therapists and occupational therapists and speech therapists to help kids be prepared for going home. So sometimes that looks like joining a therapy session where Halo goes up the stairs first, and then the patient goes up or feels like they can do that too, even though it was scary and hard that they have Halo there to comfort them. And if she can do it, they can do it. But then she also does a lot of support as we talk about going back to school and what are some things that you might say to your friends or family about where you've been or what might be different now. And so being able to rehearse those with Halo, who's a very sweet and loving presence. And then we also even do really fun co-treats like Sarah was talking about with Galaxy's outfits. Having Halo get dressed in some really funny outfits gives kids the opportunity to have control and do things like dress up, but also helps them meet some of their therapy goals, like getting dressed for the day or brushing their teeth. We can brush Halo's teeth and then they can brush their teeth. And we've even done some fun interventions with dog nail polish where they're working on fine motor skills and they get to paint Halo's nails. So it's really fun the ways that we're able to incorporate Halo into the work that I do with our rehab and trauma populations, and to see the wonderful ways that she makes a pretty scary place for some people is the hospital, and she makes that a little less scary and can bring some fun and silliness in a really supportive and non-judgmental way.
I think a really important point that you just mentioned there is that you can actually use the dogs, and patients can use the dogs to work on some of the skills that they need to help their recovery. You could have a kid practice fine motor skills by like buttoning their shirt or writing their name a whole bunch of times or doing so many different things to practice. But all of those things are less fun than getting to paint a dog's nails, and having to say, okay, now you have to put on a shirt is less fun than saying, all right, what outfit do you want Halo today or Halo to wear today, and can we put it on them together? So that's so important and really important to think about.
Yeah.
I do notice that behind you, you have a drawing of Halo on the wall. So is that something that one of the patients might have made?
Yes, we actually have an entire wall. I can try and move the camera of the many beautiful things that kiddos have made for Halo. So it's been really fun getting to do arts and crafts with kids and help them, reach their goals, but they're also really sweet keepsakes that we treasure, and obviously display in her little area of our office.
She gets fan mail, which is especially important to think about. Okay, well, let's go ahead and move on, because again, we have several others that we want to talk to this afternoon, or I guess one other pair that we want to talk to, and we may even have time for some questions and comments. Now, we did just get a comment on Facebook from someone who clearly knows our next guest. He says, Ralph! So next we're going to get to talk to Ralph. Ralph and Kizzy are going to be our next pairing that we're going to speak with. And they're going to tell us about, they do some slightly different work. While our other pairings today, handlers and dogs, work with maybe specific populations in the hospital, Kizzy and Ralph kind of go wherever. So let's hear a little bit about what that is like.
Yeah, hi everyone. I'm Kizzy. Oh my gosh, Ralph is drooling. And this is Ralph Lauren, who is my incredible drooly dog who has been working alongside me for next month 7 years. He is an 8.5-year-old golden. I would love for him to look at you, but I'm holding treats, which is why the drool situation is happening. Ralph and I work on as a consult service here in the hospital. So everywhere that Halo and Galaxy don't serve, that's where Ralph serves. And so we work a lot in behavioral health and psych. We work a lot in oncology, sometimes in our outpatient clinics, really going wherever we're the most needed. So we get a ton of referrals. We almost never can see every kid that we get a referral for. So we have to work really hard to understand what's the goal and where can we have the biggest and the best impact. So if we can get a kid home faster because they accomplished a goal because of Ralph, if we can get a kid telling their story of a really hard thing that happened to them that's really, really hard to talk about, then we will go to those places first. And kids, in my time of 7 years with Ralph, kids have told him a lot of secrets right in his ear, but they've also told me a lot of secrets and things that have been challenging to talk about, I think, because they immediately trust me because I'm connected to this guy who is, as Devon said, just like not able to even judge them, even if he wanted to. He just can't do that. One of Ralph's great gifts is he is a trick doer, and I have treats, which is why we're very squirrely right now. But he does a lot of distracting kids. So something painful is happening, something distressing is happening, and we try to do some tricks so that kids have something else to focus on. And so I'm going to show you a couple things. Come on up, Ralph. He does all of his tricks in English, but he also does them in Spanish for any families who come in and don't speak English. And so I think it's really comforting to have an additional bilingual service provider in the hospital that's not just a human. So I'm going to show you a few things that he does. I can ask him for a kiss, which in Spanish is besito, and he will boop my nose, which is kind of like a hospital epidemiology approved way of giving a kiss. I can ask him to chocolate, which is another way of asking for knuckles, and he'll give me knuckles. I'm gonna attempt to show you my very favorite trick he does. Wait, can you wait? Esperate, thanks for the kiss. Where I held a treat in my hand and I go like this, and then Ralph can't see it, and I ask him, hey, can you show me where it is? He says it's in this one. Oh, he told me twice. And he hit the computer. Let's see if he's right. And good boy, he got it. So that sort of, Ralph has become famous. He's been working with me at Children's for the past 2 years. And I would say he's really famous for doing those tricks and being a really quick learner. Because we cover so much ground, our hospital is enormous and provides services to so many kids and families. It's very, very hard, like I said before, for us to meet every kid. And so we have created a library. I'll show you a few books. We've created 18 books featuring Ralph. As a patient here at Children's. So this is in our procedure center. Ralph gets a procedure, and if you can see, he's breathing into a mask in a procedure suite. And so this book we show to kids all over the hospital. It is sequential. He is checking in. He's getting his vitals, and we really did put all the things on him that he needed. And it's all the way through going to sleep in the operating room, which is the last thing kids usually remember, and then waking up. And then the best part is having a popsicle at the end, which kids love to know that not only did Ralph get to have one, but they probably will too. So we have books for all kinds of things, just that same way. This is Ralph Goes to Radiation Therapy. We really took him over into the radiation therapy suite and went through that process with him. So like I said, we have 18 of those that are used even when Ralph's not present to help kids understand that, look, this is safe and we know you can do it because Ralph did it. My favorite one personally is not a prep book, but it's Which Ralph Are You Today and Why? And it is, hi, it is a book that includes a bunch of different emotions and feelings that kids might have. And then they are able to, like, this is a picture of Ralph looking really frustrated. And so they're able to, instead of being so vulnerable to say, I feel really angry or I feel really scared, they can say, I feel like Ralph felt this day. Am I boring you? So a lot of what we do is provide those resources and services to our colleagues that are child life specialists in other areas and ask them to utilize those with patients who might be feeling really anxious. And in some cases, kids will chase us down the hallway and be like, that's Ralph, I saw Ralph before I had surgery in a book about Ralph Goes to Surgery. So we know that those are really helpful and kind of help. A big part of what child life specialists and dogs do is just normalize this environment and make it not so scary and kind of soften it. And so I think that's one of our big priorities, is to reach as many kids as we possibly can in whatever way. And sometimes that's in a book.
Absolutely. I think one thing that's really, really crucial to highlight here, especially if you're someone, anyone watching today has not ever worked with children before, has not spent a lot of time with children, is that sometimes feelings can be really, really difficult for kids to really identify and express. And something like a medical procedure, even as an adult, medical procedures are scary. Even adults going to get surgery or recovering from a trauma or something happening to them is really scary and really difficult. And I know our audience watching today can't see it, but the other handlers are nodding along with me like, yes, it's really scary, yes, even as an adult. And it's especially scary for kids because maybe they've never experienced something like this before. They don't have a frame of reference and they may not have a vocabulary to say, I understand why I have to go through this, but I feel really nervous about X, Y, and Z. And so having these animals here, A, to show them that it's safe, B, to help them get ready for their recovery, C, to help them say, I'm feeling scared, I'm feeling excited, I'm feeling frustrated. All of those things are important reasons why we have medical and facility dogs. Now, we do have a few minutes left, and I want to ask some more questions of all of you. I haven't seen, oh, I do see one question. I'm watching on my device to make sure we have, or see if we have questions coming in. I do see one question, and then I have a few for all of you. We'll have you answer this one, Kizzy. Can you buy Ralph books anywhere? Is that something that is available widely?
You know, I wish I could say yes and just come to our gift shop. We're not at that stage yet, but it is definitely something that even I would say some of the biggest champions of our program and our work are actually our hospital administrators and executive leadership. And they are like, why aren't we selling these? In fact, my favorite book that I didn't show on camera today is called Stop and Smell the Flowers, Advice from a Good Boy. And it's Ralph, the cover is Ralph smelling flowers. And then every page is a different recommendation. And then he has like spend time outside and speak nicely to yourself. And that's the one that they're like, kids need this, and this needs to be a bedtime story for them. So we will get there one day. We're just not there today.
So stay tuned, everybody. Someday there will be Ralph books that you can buy and keep in your home library. I think I need that advice sometimes, especially the go outside one. I spend a little too long watching screens most days. So thanks, Ralph, for that wise wisdom. All right, well, let's take a look at a few questions. I haven't seen a ton come in our Facebook feed. So if you are watching and you have a question for our handlers and for these dogs, please pop it in those comments. I am watching along and I would be so excited to get to ask them of the experts, especially our doctors. But I have a few questions of my own. So what is one thing, and anybody feel free to chime in on this one, what is one thing that someone who's only loosely familiar or maybe not familiar at all with medical or facility dogs maybe wouldn't realize about your profession? Maybe how you get to have a job like yours as a handler, or what your day-to-day work actually looks like, or what it's like to actually work with this dog every single day. Sarah, we haven't heard from you in a little while. Do you have anything to add to that one?
Yes. I think one thing that can be not wrong, like a misconception, but maybe only part of what we do, is we hear that you just have the most fun job ever. It's the best thing in the world, which I agree with in a lot of ways. I mean, Galaxy is like the best partner to be able to have at work, and I think we all feel that way about these pups. But sometimes the work we do can be pretty hard, kind of like everyone was talking about. You know, we meet kids and teens and families on some of their very hardest days, whether they're facing a new diagnosis or some really hard news. And so not only do we show up with the fun costumes and with the silly, antics and the fun books, but we also show up to listen and to sit. And I think these dogs are some of the best listeners we have in our hospital. And we do our job as child life to help kids process kind of what they're feeling. But I think that maybe some things that people don't always see, which is not a bad thing, it's just, but it's also part of our job, is that we sit with kids and teens and families in some pretty tough days. And our dogs do that too. And I feel like one thing I didn't know that I learned about Galaxy is that he totally feels like those feelings. Like he senses when it's like a sad room versus when things are really happy and exciting. And he is able to kind of meet people where they're at, which is a pretty cool thing that these dogs can do. So I think that to me is something that is part of our job. It's not always seen, but definitely there.
Yeah, it's really important for dogs to have that empathy. And I think dogs have that empathy in a way that no human can. Even the most empathetic human out there, not as good as a dog. It's just the truth. That's just science, everybody. Devon, anything you want to add to that?
Yeah, I think one other thing that I don't think everyone thinks about or recognizes is that, at least for Halo and I, as much as we would love to be able to visit every single kid here in the hospital to make it a more warm place or to make it a little less scary, that each of our interventions are going to be goal-based. We want to be able to support every kid, but we just don't have the bandwidth. And as you can see, Halo just needs rest sometimes as well. And so, like Kizzy was talking about, we have to go to where we're needed most. And so our interventions are going to be things like helping a kid get up after surgery, or helping them, Halo can take medicine from a syringe. So if she can do it, then this kiddo will feel brave enough to give that a try. And then hopefully they'll be able to to reach other goals so that they can leave the hospital and get back to their normal lives. So I think sometimes people don't realize that each of our interventions are going to be very well thought out, and there's going to be a goal, and it's going to be to help reduce a patient's anxiety, but also help meet a need that they have so that they don't have to stay here in the hospital. So I think some people tend to think that these dogs are able to see every single kid who wants to meet them, or that we can just quickly say hi to everyone. And as much as I think we could all agree that that would feel really lovely to never have to disappoint anyone, but that our interventions are going to be goal-based and therapeutic-based interventions.
Yeah, that's an important thing to make sure we clear up, because it's not all just petting cute puppies and going on walks around the hospital. It's hard work. This is a hard job that you all do. And we did just get one lovely comment on Facebook from Tisa saying, thanks for all you do. So thanks for being incredible providers. We are almost out of time. We have only a few more minutes. And one question that I've seen come in a couple of times in the last few minutes is a question about how dogs actually get to do this kind of work. And so, Corey, I'm going to actually pitch this one to you. You don't have a dog sitting on your lap, so I don't know, maybe you have a little more brain space to answer a question for us. You don't have to stroke anybody's ears. But can you tell us, are there any particular breeds that are especially suited to this, or maybe really sought after for professions like this or for work like this one? And could any old dog do this work? Like, could I volunteer my 14-year-old Jack Russell Terrier to come? And I'm sure he would love that, but I don't know how good of a job he would do.
That's actually a comment that we hear a lot from folks who meet us in the hallway, or who who are patients of ours or whatever. We hear, oh my gosh, I really need to get my dog into this. How do we do this? And we totally value and understand how important pet therapy can be. What we do is a little bit different, and our dogs were actually born and raised to do this job specifically. So our hospital worked very closely with a service dog organization, and there are many all across the country, but all three of our dogs came from the same one. So our pups were born and raised to do this. So as they got older, the volunteers and the people who work at this organization who were raising them kind of took a look at what their temperament was like, and they noticed that all three of our dogs have the social stamina to be suited for like a hospital. So they get to meet lots of different people throughout their day, and they are able to show up and be just as excited to meet the next person as they were the first patient that they saw that day. So that in a nutshell, they were born and raised to do this. They had about 2 years or so of learning before they came to us. And then we've continued to work with our dogs to make sure that whatever the needs are in our specific unit or in our hospital, that our dogs are ready to go.
Awesome. Yeah, I keep saying this is an important note, but this is just a half hour full of very important notes. Dogs are amazing, and all of our dogs do incredible things for us. I don't have an animal like this in my home, but getting to talk to my dog at the end of a long day, or to pet his fur, or to talk to him about what I'm feeling frustrated about, that's amazingly helpful to me, but it is different than what these dogs do. So yes, thanks for making that distinction. We are almost out of time, but Kizzy, I'm going to direct one last question to you. And that's just in case we have anybody watching today who's maybe like, you know what? I think I want to do that when I grow up. So how do you actually become a handler for a medical dog? And what sorts of things might someone who's interested in your career need to know, other than, get yourself a Ralph?
Yeah. Well, it's really interesting you say that, because when I started doing this work, there were very few, less than a handful of people in the world doing this work, which seems so crazy now because there are programs like this popping up all over the place. But when I first started, I had a little girl, I'll never forget, who her mom was like, tell her. And I was like, oh no, tell me what? And the little girl said, I want to be you when I grow up. And I was like, oh yeah, maybe when I retire, you can have my job. By then you'll be ready. I'll be ready. It'll be perfect. And in the back of my mind, I was thinking this really isn't like a job you can grow up and do. And now it is. Now it's wild. There are positions that are posted to do this exact work. We will grow our program and have internal people take over being handlers for future dogs. I really think it's really nicely paired with child life. And so as we said before, we're all child life specialists and did this work clinically before we had dogs. And so that's where I recommend it. I think a lot of the programs are going to stay under the umbrella of child life within hospitals. And so if working with kids and helping them through really scary, daunting experiences is something that feels suited for you, and you also love animals, and you also love juggling 13,000 things at the same time, then that it might be a good path. And starting by understanding really kids and how they process trauma and scary and hard things, and then doing that work first is a great starting point, I think.
There you go. So if anybody out there is watching and says, you know what, I want to hang out with Ralph, or I want to hang out with a Galaxy or a Halo. I mean, Ralph's one of a kind, so you might have to find yourself your own, but that's important advice. That's good advice for anyone who's interested in this really budding career. Yeah, it's not something one could do even a short time ago. So that's exciting news for anyone who wants a really amazing and adorable career with animals. So that is all the time we have for today. Unfortunately, we weren't able to get to every single question, so my apologies if we weren't able to answer yours, but we do need to wrap things up. This is an important career, and as Kizzy mentioned, is budding. It's really emerging. So do a little bit of research, get to know this incredible career and these animals just a little bit more. And maybe you can even check out Children's Hospital on social media. Could they find these dogs all over your website or on your social media pages to learn a little bit more? I'm seeing some nods. So there you go. Everybody do your research, and that is the cutest possible research that you could do. I know you couldn't see my face the whole program, everybody watching out there, but pretty much the entire time I was like, oh my God, because this is the cutest thing ever. I have the best job in the whole museum today. So a huge thanks to all of you who watched on Facebook and on YouTube, and a huge thanks as well to all of our handlers and dogs. Thank you, Kizzy and Ralph. Thank you, Devon and Halo. Thank you, Sarah and Galaxy, and Corey, who hangs out with Galaxy as well. Make sure, if you haven't already done so, to check out Dogs, A Science Tale, our current temporary exhibition. It is on exhibit until January 3rd. And in case you didn't know, that's not very long from now. We are in our final weeks, maybe our final wags is what we should call it. Come on down to the museum. We are open with so many different safety measures in place to make sure that things are clean and safe and you are comfortable. So come on down. You'll be able to explore in this exhibition everything from how our furry friends evolved on planet Earth to why their sense of smell is so good, to what their body language might tell you. And you can even see if you can run as fast as a greyhound, or maybe you're more the speed of a Pomeranian. So check it out. You can find tickets. Reservations are required. dmns.org. Check us out. We're so excited to have you all come and pay us a visit in these final weeks. Thanks, everybody. We're going to go ahead and sign off. Thanks for watching today. And I'm going to have all of our handlers unmute if they want to say a big goodbye. Halo's already waving. Thanks for being here today, everybody.
Bye.
Bye. Thanks.
Thanks for having us.
Bye, Bubba.